Hi, this is Dr. Rakhi Dotre, your ENT specialist from PD Hinduja Hospital, Khar, Mumbai. I am going to talk to you today about the side effects of using the headphones for a prolonged period. Whether sitting in a coffee shop, walking around in a busy street, strolling around in the mall or working from home, it seems like everybody is using headphones or earbuds in their ears. But have you ever stopped to wonder what all this noise or the sound is doing to your hearing? How loud is too loud before a hearing loss sets in? Sounds as low as 70 decibel to 85 decibel can start causing a noise-induced hearing loss. The players which we use today are having a sound of around 120 decibels, which is approximately the sound which is produced at a rock concert. At that level, the hearing loss can set in within an hour or 15 minutes also. The Occupational Safety and Health Administration recommends that the person be exposed to 85 decibel sound for less than 8 hours when the employees are working in a noisy environment. Some common sounds around this range are the heavy traffic, the noisy restaurant, or the vacuum cleaner which we use day to day. So it implies that the less time you listen to a louder sound, the chances of having damage to your hearing is less. The type of hearing loss caused by the noise can be gradual, cumulative, and without obvious signs. Sometimes we can get a ringing sound in the ear, roaring or hissing sound, or a buzzing sound, which is typically called as tinnitus. There may be a difficulty in understanding a normal speech in the noisy environment. Sometimes the sound may sound to be a muffled sound, or there may be a feeling that the ear is plugged. Listening to the TV or radio at a higher volume than in the past, we can get non-auditory effects like increased BP, increased stress, increased irritation also. Unfortunately, the type of hearing loss caused by overexposure to very loud noise is irreversible, making prevention paramount importance. At the highest volume setting, most technologies can produce sound from 105 to 120 decibel. This volume can damage the hearing in as little as 5 minutes. If we can hear the sound played from the earbud at a few feet away, then definitely that is a very high volume. We recommend the 60-60 rule. That means you should not cross the volume of the headphones from 60%, and we should not listen for more than 60 minutes at a stretch. This is the rule which will decrease the risk of hearing loss from the headphones and make it safer for use. What are the steps we can take to protect our hearing? The first is to turn down the volume of the music so that we can comfortably hear the sound and it is not irritating or blasting in the ear. When there is competing background noise, it is advisable that we use a noise cancelling headphones. The other way is to set a safe limit on the device so that you don't increase the volume beyond a particular limit, or whenever possible use the speakerphone. If you suspect any loss, we have to get a pure tone audiogram and consult ENT doctor. Depending on the degree of loss, we can do intratympanic injections. Intratympanic injection sometimes can reverse the hearing loss when there is a hearing loss in the acute stage. Some patients may need hearing aids, or those who are having a profound hearing loss can need a cochlear implant. Timely intervention can save the hearing. Prevention is best, but if you cannot avoid altogether the use of the headphones because of your profession, then follow the advice and be safe. Thank you.